Hi, this is Dr. Chan here at Crown Dentistry. We've been getting a lot of questions about dental cavities. So today we're going to talk a little bit about dental cavities, what they are, what can be done about them, and hopefully it will give you a better understanding of what dental cavities are. So when we say cavity, we're basically talking about a breakdown of the tooth structure. So you have your teeth in your mouth, they're super strong, right? Our teeth are made of the hardest substance in the human body, enamel, and the second hardest substance in the human body's dentin. However, they're not indestructible. They are things that can break down or ruin our teeth. One of the biggest things is cavities. So basically, cavities are when a tooth breaks down, usually due to acid attack from bacteria in our mouth. It sounds really complicated, but basically, there's lots of things living in our mouth right now, in all of our mouth. It's bacteria, and that bacteria, they produce acid. And that acid is harmful to our teeth. One of the biggest things that we hear talking about is that, oh, you eat sugar, it's bad for you. The reason why it's bad for you is that it makes the bacteria grow. And the more bacteria that are in your mouth, the more acid that's in your mouth. The more acid that's in your mouth, the more potential you have to have cavities form. That's what we tell people. Reduce or limit the amount of sugar that you're putting in your body. The biggest thing that causes cavities is acid from the bacteria that's in our mouth. That acid is harmful to our teeth, and if there's too much of it, it can cause cavities to form in our mouth. So there are a couple of different things that we use in order to see if there's cavities in your mouth. One of them is just by looking. Usually when teeth have cavities, they either change color or appearance. Sometimes the color of the teeth will turn either brown or yellow or orange or milky white. It kind of depends. Cavities look different in different kinds of people. Also, it kind of depends on what you eat and how far along the cavities are. A lot of times when cavities are bigger, the color will change, usually to something darker. Usually in the early stages, when cavities start, they can be kind of a chalky or a milky white color. So a lot of times a cavity will start at a stage that can be called incipient or just early stage cavity. A lot of times these cavities may be visible on an x-ray. Sometimes they're visible in the mouth. A lot of times the tooth may not even show signs of decay or cavity because it's in a place that we can't see with our eyes. They're in between the two teeth, or perhaps it's stuck in a really deep part of your tooth. So if the cavity isn't treated, it will continue to grow. This growth can also be seen on x-rays at times. Sometimes it can also be seen when we're checking your teeth on a regular periodic exam. As the cavity continues to grow, we'll break down more of the tooth, and that's usually visible on an x-ray. We can also sometimes feel it when we're checking your teeth. Usually when we're checking healthy teeth, they don't get injured or infected or changed by any of the instruments that we're using. But when there's a cavity present, we can definitely feel it and see the difference when checking the teeth with our instruments. So cavities, sadly, if they're on one tooth, a lot of times they won't stay on just one tooth. They'll move around to different teeth, especially ones that are in the same vicinity as a tooth. A lot of times if a tooth has a cavity on the side of it, it'll usually jump to the tooth right next to it just because, like we've said earlier, cavities are caused by bacteria. Bacteria don't tend to limit themselves to just one tooth. They're going to go wherever they want in your mouth. So a lot of times cavities can definitely spread from one tooth to another. So once a cavity is in the mouth, it's basically going to be there unless we can remove it. There are a few early stage cavities that potentially can be reversed using certain systems, but those are very rare. For the most part, once a cavity is in your mouth, it needs to be physically removed, either by drilling or scraping it out, and then filled back in with some sort of filling material. For the most part, once a cavity is in your mouth, it's very difficult to stop it from getting any bigger. Sometimes really good oral hygiene and limiting the amount of sugar that you intake, whether it's for food or drink, can sometimes slow the growth of the cavities. But for the most part, once a cavity is in your mouth, it's going to just continue to grow. The question is just simply how fast will it grow? So usually when a cavity is removed from your tooth, which is still the best way to make sure that the cavity doesn't grow, once it's removed, there's obviously a gap or a space in the tooth. So we can't leave that gap or space there. So usually in order to fill that gap and restore your tooth to its previous state, we'll put a filling in there. Nowadays we use almost exclusively tooth-colored fillings. So it's difficult, if not impossible, to see that a filling was placed in your tooth. In terms of how long it lasts, I've said this before in other videos, a lot of it depends on your own hygiene regimen at home. Are you good about brushing? Are you good about flossing? Are you good about just rinsing your mouth out and after you drink coffee or your Starbucks or soda or something like that? The better you are about keeping your teeth as sugar-free as possible, the longer the potential fillings can last. Because even though a filling has been placed to fill a cavity, it doesn't mean that more cavities can't develop in the future. I always tell people, it's kind of like when you get sick. You do the things that you need to do to get better, but it doesn't mean that you'll never get sick again. So kind of the way it is with cavities as well. Dental cleanings are a really important part of keeping your teeth clean and healthy. I would say that if people are regular about getting their teeth cleaned by us and our hygienists, they tend to have low rate cavity formation. It doesn't mean that they'll never get cavities, but I always tell the patients that you're giving yourself the best chance to stay cavity free if you're good about getting your regular cleaning stuff. If you think that you have a cavity, the best thing to do is to come and give our office a call, and we can check and see if you do. Sometimes the way that you'll know if you potentially have a cavity is that it'll hurt to bite on that tooth. It'll hurt when you eat or drink cold stuff, sweet stuff, or sometimes you'll just have an aching or a throbbing or a sharp pain in your teeth for no reason. If any of these things are happening, please do call our office so we can help you figure out what's going on. I hope we've been able to answer some of your questions about dental cavities today. If you have any more questions, or if you're ready to take action, please call our office at 916-285-9678. We're here to help.